Every day, UMass Memorial Health Care teams meet in creative, collaborative idea huddles and innovate new ways to better serve our patients, celebrate each other, and work toward achieving true north. This year, you will help choose which of our Sweet 16 finalist teams will win the coveted Innovators of the Year award. We've narrowed down the nominations based on each team's overall idea system. In a series of short videos, you'll learn about each team's most innovative idea and its impact. And starting December 13th, you'll vote for your favorite. Now, in completely random order, here are the first 4 of our Sweet 16 teams. Medical Center, Emergency Mental Health. This team's most innovative idea was aimed at improving patient flow in the emergency department.
It would be beneficial for our nurses to be trained as clinicians and help to evaluate the patients in order to help with the flow of the patients.
The idea helped to reduce patient wait times.
It appears that this has helped to go down by about an hour in the current state. So we're looking at about 5.8 from the 6.8 since those nurses have been doing the evals.
Congratulations, Sweet 16 finalist team, Medical Center Emergency Mental Health. Our next finalist team is Information Services Desktop Services. Their most innovative idea, fixing a problem before it's even a problem.
We wanted to instead be a proactive provider. We wanted to make sure that we were rounding and getting in front of problems before the user really experiences them in the field.
And the impact is
$14 a ticket that we're saving each time that we create a ticket on our own without going through the support center. It really adds up. And to date, we have a total cost savings of $31,752.
We save them the time of calling the support center, making the patient wait, preventing the staff from scrambling around trying to fix the computer, instead they can focus solely on the patient.
Congratulations, Sweet 16 finalist team, Information Services, Desktop Services. Our next finalist team is Medical Center 5 East. This team had so many ideas, their most innovative idea was spending a whole day to talk about them.
We were all together, and what we did was come up with a process to help fix the admissions and the flow problem.
Here's just one of the ideas that came out of this day-long event.
And one of the biggest things that we fixed within weeks was the ED nurses had no access to see our patients up here on the floor, like if they were in the OR or if they were being discharged that day. All they could see is if a bed was empty. And so that patient could have been on a procedure and they would have no idea. So we actually worked with Epic and got the ED access to our bed board that we can see, which has tremendously helped our trust between each other.
Congratulations, Sweet 16 finalist team, Medical Center 5 East. And our last finalist out of this group of 4 is Medical Center Emergency Department Memorial Campus. Their most innovative idea was to revamp an important emergency department process and one of the very first points of contact patients have with the team.
And we were able to, using this idea and this process, go from taking over an hour to get patients back to a room to under 5 minutes.
This idea made our triage process a lot more efficient. Our door-to-room times prior to this going into effect, this time here of 18 minutes is actually a lot higher. There was 45 minutes of time where a patient would write their name on a piece of paper before they were even entered into the computer. So our true time of patients arriving to door into a room was about up here. And now we're significantly under the 5-minute mark for patients getting in to see a provider.
Let's hear more about the impact of this idea.
Well, it certainly affected our patient experience. So we were at 75% here, and we rose almost up to 90%.
Congratulations, Sweet 16 finalist team, Medical Center Emergency Department, Memorial Campus. And there you have it, the first set of 4 Sweet 16 finalist teams. Stay tuned as we celebrate our next set of finalist teams.